If you are over 60 and you are watching this video, I want you to do something for me before I say another word. I want you to think of every medication in your medicine cabinet right now. Every prescription, every over-the-counter pill, every gel, every supplement. Because by the end of the next 15 minutes, you are going to realize that there are 6 categories of medications sitting in that cabinet that have been quietly and dramatically increasing your risk of a heart attack, and that almost every senior over 60 is taking at least one of them. 3 of them are sold at every drugstore in America without a prescription. 3 of them are prescribed routinely by primary care doctors who have not been trained to think about cardiovascular risk. And one of them, the one I will save for last, sign number 1, is being aggressively marketed right now to men and women in their 50s, 60s, and 70s as the elixir of youth, and it is putting people in cardiac care units every single day. In my years working in cardiology and seeing patients in the emergency department after their first heart attack, I have lost count of the number of times the patient or their spouse has said the same sentence to me. They say, "But doctor, that medication was prescribed for me." They say, "But doctor, I bought that at the pharmacy, it cannot be that dangerous." They say, "But doctor, my friend has been taking that for years and she is fine." And every time the answer is the same. The medication was prescribed for one reason, to treat the immediate problem the patient walked in with. The cardiovascular risk that came with it was either not discussed at the visit, or it was discussed too quickly and forgotten, or it was buried on page 11 of the package insert that no one ever reads. The result is that millions of seniors over the age of 60 are walking around carrying a hidden cardiac risk in their medicine cabinet that they did not know they were carrying. Today I am going to walk you through all 6 of those categories, counted down from 6 to 1 in order of how aggressively they raise your risk. By the end of this video, you will know which medications to ask your doctor about at your next appointment. You will know which over-the-counter pills to put back on the pharmacy shelf the next time you reach for them. And you will know the one specific question to ask, the one question that, in my experience, opens up the conversation that prevents the heart attack from ever happening. Before we begin, the standard disclaimer that every senior watching this video needs to hear me say out loud. Do not stop any prescription medication you are currently taking on your own based on what you hear in this video. Do not pour your pills down the drain. The decision to stop, to adjust, or to substitute a medication is a decision that belongs to you and your doctor together, and it requires a conversation that takes into account everything else going on in your body. What I want you to do is take notes, bring those notes to your next appointment, and ask the question. That is the goal of this video. Sign number 6, decongestants. The hidden cardiac risk inside every box of cold medicine on every pharmacy shelf in this country. You know the scenario. You catch a cold, your nose feels like cement, you cannot breathe through it, and you walk into the pharmacy and grab the first box of Sudafed or Dayquil-style oral cold medicine you see. I will say up front, the topical nasal sprays like oxymetazoline, sold as Afrin, act mostly locally and carry less systemic cardiac risk, although they can cause rebound congestion if used more than 3 days in a row. The bigger concern for the heart is the oral decongestants. Within 20 minutes, you feel like a new person. The pressure releases, the airways open, and you can breathe again. What that box does not tell you, in language that any senior over 60 can understand, is the mechanism by which it cleared your sinuses. The active ingredients in those medications, pseudoephedrine and phenylephrine, do not act selectively on the blood vessels in your nose. They act on every blood vessel in your body, including the coronary arteries that supply blood to your heart muscle. They cause those vessels to constrict, to clamp down, to become narrower. And they trigger your body to release noradrenaline, which is the stress hormone that tells your heart to beat faster and harder. Now picture what that means for a senior over 60 who already has some plaque built up in the coronary arteries, which, according to the American Heart Association, applies to a substantial majority of people over 60. The artery is already narrowed by plaque. The decongestant clamps it down further. The heart is being told to pump faster and harder against the more constricted pipe. The risk of a coronary spasm, an event where the artery suddenly closes off and will not reopen on its own, goes up sharply. Observational studies of oral pseudoephedrine, the stronger decongestant that you have to ask the pharmacist for behind the counter, have linked it to a measurable increase in heart attack and stroke risk in the hours immediately following use, particularly in adults with cardiovascular risk factors. And there is a separate development that almost no senior knows about. In 2023, the FDA convened an advisory panel to review the evidence on oral phenylephrine, which is the active ingredient in most non-prescription cold medicines that sit on the open shelf at the pharmacy. The panel concluded that oral phenylephrine, at standard over-the-counter doses, does not actually work for nasal congestion as advertised, which means that millions of seniors are reaching for a medication that the science says is not delivering the benefit they think it is. The cardiac risk signal is stronger for the behind-the-counter pseudoephedrine than for the front-shelf phenylephrine. But the principle for any senior over 60 with cardiovascular risk factors is the same. There are safer ways to clear your sinuses. What to do instead? Saline nasal rinses, a steam inhaler, a humidifier in the bedroom at night. And if allergies are driving the congestion, plain loratadine, sold as Claritin without the -D, is a much safer option for your heart. Avoid the -D combination products that bundle in a decongestant, because that is where the cardiac risk comes back in. Do not trade 20 minutes of clear sinuses for a coronary event. Sign number 5. Anti-inflammatories. The over-the-counter painkillers that almost every senior in America keeps in the kitchen drawer. Ibuprofen, sold as Advil, Motrin. Naproxen, sold as Aleve. Diclofenac, sold as Voltaren. These are the non-steroidal anti-inflammatories, the NSAIDs, and they are among the most widely used medications on planet Earth. Your knee hurts, you take an ibuprofen. Your back is sore, you take an Aleve. Your headache will not go away, you reach for the bottle. The mechanism is genuinely terrifying once you understand what it is doing. Your blood vessels have a built-in protective system, a chemical called prostacyclin, that does two jobs at once. It keeps the inside of your arteries smooth so platelets do not stick and form clots, and it keeps the vessels relaxed and open so blood flows easily. Every time you swallow an ibuprofen or a diclofenac, you block the enzyme that produces prostacyclin. The protection turns off, and three things start happening at once. First, your blood vessels tighten and your blood pressure goes up. Second, your platelets become sticky and start clumping together in clots. Third, your kidneys hold on to salt and water, which strains the heart further. In 2015, the FDA strengthened its black box warning on prescription NSAIDs and reinforced its safety advisory on the over-the-counter versions, stating clearly that the risk of a heart attack or stroke can begin within the first few weeks of use, even in people who have no prior history of heart disease. A 2013 Lancet meta-analysis of randomized NSAID trials concluded that systemic oral diclofenac raises the risk of major vascular events meaningfully compared to no NSAID use, and that high-dose oral ibuprofen approximately doubles the risk of heart attack at the dose levels used in chronic pain management. I want to flag one practical exception. The topical version of diclofenac, Voltaren gel applied to skin, has substantially lower systemic absorption than the oral pill, and most evidence suggests considerably lower cardiac risk. Oral diclofenac is the form to be cautious about. There is one important note on aspirin in this category. Low-dose aspirin, sometimes called baby aspirin, works through a different mechanism than the NSAIDs above, and may be prescribed for secondary prevention after a cardiac event. But starting low-dose aspirin on your own without a doctor's guidance is not recommended, because aspirin carries its own bleeding risk, and the benefit depends on your individual cardiovascular profile. And acetaminophen, sold as Tylenol, is a pain reliever, not an anti-inflammatory, and it does not carry the same cardiac risk. So if you have pain that needs a pill, Tylenol is a much safer choice than ibuprofen for most seniors over 60. Sign number 4. Proton pump inhibitors, what doctors call PPIs and what most seniors call their stomach pill. Omeprazole, sold as Prilosec. Pantoprazole, sold as Protonix. Esomeprazole, sold as Nexium. PPIs are among the most widely used long-term medications in seniors over 60, with many patients taking them daily for years on end. And the assumption, almost universally, is that they are as safe as water. The reality is more complicated. PPIs may have an effect beyond the stomach. The proposed mechanism is that they reduce the production of nitric oxide in the cells lining the inside of your blood vessels, the endothelium. Nitric oxide is the molecule that keeps your arteries relaxed and smooth. When its production drops, the arteries stiffen, inflammation in the vessel walls can increase, and the rate of plaque buildup may accelerate over time. A Stanford-led study that analyzed records from nearly 3 million patients found that adults using PPIs had a measurably higher rate of heart attack, with some analyses showing up to a 21% increase in risk compared to non-users. A separate body of research has linked long-term PPI use to a modestly higher risk of cardiovascular death, with most studies showing increases in the range of about 10 to 50%, depending on the population and duration of use. I want to be clear about what this evidence is and is not. These are observational signals, not proof of causation, and the size of the effect varies across studies. Now, I want to be careful with this one. If you are taking a PPI for 7 days because of an acute episode of gastritis, that is not what these studies are about. The danger is in the chronic, indefinite use. The patient who has been on omeprazole every morning for 6 years because no one ever revisited the decision. If that describes you, the next time you see your doctor, the question to ask is simple. Doctor, do I still need to be on this every day, or is it time to step down? Many seniors on long-term PPIs can be safely transitioned to less frequent dosing, to a different class of acid reducer like an H2 blocker, or to no medication at all, depending on what is driving the symptoms. Sign number 3, stimulants. The prescription drugs originally developed for children with attention deficit hyperactivity disorder that have now become extraordinarily popular among adults in their 50s, 60s, and 70s who are trying to stay sharp at work, manage a demanding schedule, or lose weight. Methylphenidate, sold as Ritalin and Concerta. Lisdexamfetamine, sold as Vyvanse. The mechanism by which these drugs work is by flooding the body with norepinephrine and dopamine, adrenaline-like chemicals that make the heart beat faster, the blood pressure rise, and the blood vessels constrict. In a healthy young adult, the body can absorb that. In a senior over 60 with any underlying cardiovascular condition, diagnosed or not, that combination of faster heart, higher pressure, and tighter vessels is the recipe for a cardiac event. A large Swedish study published in 2023 that tracked over 250,000 people on stimulant medication found that 5 years of